This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Regina League.
Well, hi, everybody, and welcome to another episode of the Good Neighbor Podcast. I'm super excited to speak to my personal dentist, Dr. Becca Bradley. She's the owner of the stunning office here in South Charlotte, QC South Dentistry. Hi, Dr. Bradley. How are you today?
Hi, I'm great, Regina. Thank you for having me.
Right. I'm so excited. I'm not, in your chair talking to you today.
Yeah, this is much better, right?
Yeah. I was getting the Invisalign. Tell me the device, what it's technically called that you fitted me for.
Oh, for your retainers?
Yeah, the grinding I do and all of that.
Yes. So we scan every patient that comes in, which is essentially just taking thousands of pictures per second and making a 3D model, which is a great education tool. We can show you what's going on there. We can compare from visit to visit because my memory is only so good. We can actually watch changes like recession or wear on your teeth. And then from that scan, I use it for Invisalign. I just send it to the lab. They make it. Even crowns, we send to the lab. They make it. And then in your case, it was, night guard, which we do, fairly often. Yeah.
Well, the last time I was fitted for something like that many years ago, let's just say 5, 6, they poured that gunk, like Play-Doh, into this massive mold and let it sit there while you're, a little bit gaggy reaction.
It's better, right? Just to have the skin. It's miles better, yes.
Well, and that scan, your technology is just amazing. That's one example. Tell us about some more things that, because your practice is new and you've got the cutting edge things.
Yes. So with a brand new office, we of course had to get just the top of state of the art technology. We have that scanner that we use every appointment. When you do the x-ray that goes around your head, it gets you that full mouth picture. Ours is actually in 3D, which is huge because I can see how does your airway look? How do your jaw joints look? How do your sinuses look? I've sent a lot of people to ENT just from that scan. It's just a really cool tool, and we don't charge any extra for it. It's just more so much more knowledge. And then on top of all that, it's less radiation, which is just insane. So when I found that out, it was a no-brainer. So those are the two biggest things that I have. But we also have just, the other x-rays we have are all low radiation. Dentistry's really come a long way in a short period of time. So it's exciting.
Well, it is, taking my high anxiety level to next to nothing. You've done some more extensive work with me, and I have to say it's a whole different experience for me.
That's so good to hear. That's literally one of my favorite things about it is I know it's not a comfortable experience in general to be at the dentist. So helping people get through that and just making it not so bad is really one of my favorite things about being a dentist. It's really rewarding.
So you call it the scan? Is that what that was? The X-ray, the 3D? I've always heard the dentist can tell a lot about your general health.
Yeah, absolutely.
When you're just looking at our throat, our tongue, what makes you guys so aware of other things happening?
Well, there's actually a lot of correlations. For example, if you have gum disease, there's a correlation to heart issues and certain other things. But in the particularly what you asked me in that 3D X-ray is I could just see it. I can see so much more than I could with a 2D. I can actually see your sinuses, and it looks like I can pretty much see your skull in 3D for less radiation than doing it in 2D. It's the coolest thing. It will be in every dental office in the not so near future. It's just the expense of it. But for me as a new office, it's all, in all the part of the practice loan. So for me, it was a no-brainer to upgrade to that.
Right. So I really didn't know a lot about Invisalign and all the ways it could be used. Kind of take us, there's some obvious things. I tell me if I'm right. Invisalign is kind of like the new way of braces. especially for adults? Do kids do Invisalign as well?
Kids can do Invisalign. I generally see more adults for Invisalign, just for compliance issues. I trust an adult more who's paying for it to wear it, because it will only work if you wear it. But as long as you're wearing it, it works really well, and it absolutely will work for kids too. You just have to know your kid and then decide if they're going to wear it. But essentially what it is you get a bunch of plastic trays and you change them out every 2 weeks. It slowly, gently moves your teeth into alignment, which not only gives you a beautiful smile, which a lot of people come in asking for, but also it makes your teeth more functional long-term. Because if you're hitting in the right position, then they're not going to be breaking. They're not going to be wearing down and causing issues long-term. So it's really setting you up for success.
So who's a good adult candidate for Invisalign? And how severe can their situation be? Or
sure, yeah. And that's not all we do here, of course. So it's definitely always up to the patient. And I always say, if it's not bothering you, it's not bothering me. But we can see very clearly in the scan some factors that you could benefit from it. For example, of course, teeth that are rotated, misaligned, those are harder to clean. You can just see those on the scan pretty easily, and that's where we might have that conversation. Otherwise, there are kind of notches in your teeth that you can get. It's called abfraction, and that's from generally clenching and grinding. But if you're doing it where your teeth are hitting in odd angles, right? Mm-hmm. Your teeth are meant to hit, if you think of like a tree that's in the ground, if you're going to hit it from the side, if you hit that tree from the top, it's not doing much. It's just going in the ground, right? Or fence post, we'll say. If you hit it from the side, it's going to start moving. It's going to start chipping at the dirt line, which would be the gum line for your teeth. So you really want those teeth to hit like a hammer and nail. So we can see a lot of that in the scan, and that's just sometimes we'll have that conversation at an appointment. And if that's something patients are interested in, we can use that scan to move forward with treatment. But even if someone's not into Invisalign, not wanting to straighten their teeth, we still scan, because it's such a great way to, for example, I'll see someone another time like, that looks interesting. Was that there last time? We can literally just go back and forth and see the two scans, and it's really cool.
How long does Invisalign, I know it depends on the situation, but on the low side, and for how long does it take to start?
I say most of my cases are anywhere from maybe 9 months to half a year. A year and a half.
That's amazing. Do you wear them 24/7?
You wear them 22 hours a day. So you're only taking them out to eat. You're sleeping in them. And I always, I give tips. I don't like them out for more than 40 minutes. So, if you can't brush your teeth, just rinse them out, rinse your teeth, and pop them back in. You just want to wear those as much as possible. I actually just finished it on myself up top, still working on the bottom. But yeah, it's fun. I've done some staff members, so I really enjoy it. That's one of the things I love to do.
Well, I hadn't thought about that. You can do just the top or just the bottom or both.
Yeah, well, usually I'll do both, but sometimes they finish at different times. Often they finish at different times. So sometimes the bottom will need more movements than the top, or vice versa. But generally, just to get those in the right position, I'll always do top and bottom.
Awesome. Well, you do quite a bit of different things, from general dentistry. I think one thing that's very unique is you will do kids and adults. You have a waiting room where the mom can go in and the child can be out there and play and have someone kind of look after them. So that, double duty there for the mom bringing the child.
I am a young mom. I have a 2 and a 4-year-old and another one on the way. So, we definitely are sympathetic to just how hard it is to get childcare, how hard it is to take care of yourself. So anything that we can do to help, we want to do. We do see kids for cleaning often and love it and do great with it. We have a great pediatric dentist across the hall. So, if there's a lot of treatment or your child just needs a little extra tender loving care, then we send there often. But especially for when the parent has an appointment, we just try to make it as convenient as we can in general.
That's awesome. And I'm sure you being a young mom yourself, you do see things from a different perspective.
Absolutely. Yes. I want to make it as easy as possible for other young moms and dads, whoever's got the kid that day.
Well, that's a good point. You're exactly right. Yeah. When it comes to like numbing you and things like that, has that technology changed? Because I swear it didn't hurt when you numb me.
Oh, God, I'm so glad you said that.
I mean,
No, that technology has not come very far, to be honest with you. I keep saying, it's 2025. When are we going to come up with something better than this? But I do have some tricks that make it better. So I'm really glad you said that. The main thing is I'll go really slowly because the pressure is what causes that pain. So I'll go really slowly in. And then sometimes I'll kind of wiggle your cheek or something, little, honestly, distractions. But yeah, we do what we can. Like I said, it is what it is at the end of the day. We can't make it fun necessarily, but anything that we can do to make it not so bad, to help you get through something that you need to get done for your health, to really just make it easier is just so rewarding. That's what we want to do.
And we all have to come. Your location, let's talk about that for a second, because you have a beautiful new office and a whole new building, in fact.
Oh, that's right. Yes. We started when the building opened. We were first tenants in.
And you're at Ray Farms, and you're kind of back there behind Lifetime. Kind of explain where the building's located.
Sure. It can be kind of tricky to find us the first time because it's Golf Links Drive North. So Lifetime's on Golf Links Drive. And there's a quick turn there. There's a Bank of America and some other businesses. And you turn onto this little side street, and then you'll find us. One quick landmark for you is the extra space storage. When in doubt, just put extra space storage into your GPS, and it'll take you right to us because it's right next door. And it's what you can see even from the interstate. Really tall building.
Yes. And I see you had an announcement about insurance. Do you want to share that?
Oh, yes. We are now starting. So we've been open about a year, and we've been in network with some insurances, but now we're in network with most. There's very few that we're not. And essentially, the idea behind that is just to make it as accessible as possible for people to use their benefits. And we do all the legwork for you. We figure out, get you a good estimate on what it will be, but just whatever we can to make it easier for you to get your treatment done. So that's what we're kind of doing from our end. Is let's do everything we can. We know dentistry can be expensive. Yeah, we know it can be expensive, and it kind of like what I said about making appointments as easy as possible. It is what it is to a degree, but if we can make things a little bit better, that's always what we want to do.
Absolutely. It's a phenomenal practice. You're a fantastic doctor, and it's been a pleasure talking with you again today.
Oh, thank you so much, Regina. I appreciate it.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnpsouthcharlotte.com. That's gnpsouthcharlotte.com or call 980-351-5719.